Welcome everyone to the latest webinar with cosmetic laser dermatology. Really excited to be here today to talk about our proprietary treatment, the Take10. And if you don't know what it is, get ready to be amazed because we're really excited about this procedure. We're here with the one and only Dr. Groff, who does a lot of these procedures. And let me introduce you a little bit to him on this next slide. So if you don't know Dr. Groff, he is a board certified dermatologist, but you may have seen him in some magazines because he has been voted best cosmetic dermatologist and best cosmetic surgeon 6 years in a row by the San Diego Union Tribune and La Jolla Light. So, and that's all thanks to you guys voting. So we love that. It's not anything we pay for, I promise. But Dr. Groff has over 20 years of experience. He's given over 100 laser lectures in 10 different countries. He's published on lasers. He's a trainer with a lot of the companies, and you are definitely in good hands. Although today Dr. Groff is talking about lasers, he also does do injectables and body sculpting and contouring procedures as well. So, and then a little bit more about the practice on the next slide. So at Cosmetic Laser Dermatology, we have over 60 lasers and devices. We have 7 dermatologic surgeons and so many cutting edge treatments that it really is best to come in for a consultation to get through them all. We also have a full service research center. What does that mean? It means we really do research here. We help a lot of the injectables and laser companies get FDA approvals. We help them develop new indications, and a lot really on the ground floor. A lot of it is getting figured out right here at Cosmetic Laser Dermatology. And we're just so proud to have more lasers and energy devices than anywhere else in the world. So before I kick this over to Dr. Groff, I have a quick little poll. I'd love if you guys could just answer quickly. It should have just popped up on your screen here. Just a couple questions. So we can have a better chance of who we are speaking with. While you're answering these, someone said their chat is disabled. I'm not sure on your end. I'll see if I can chat you privately, but you can also use the Q&A feature to chat with me. Anyways, if you guys could just answer these questions, this is totally anonymous, and just to help us, we're curious, how many of you are existing patients or not? And have you ever attended one of our webinars before? We started doing these during COVID, and we have done a lot of them. How did you hear about this webinar? Where do you live? Are you guys local to us here in San Diego? We do have patients that do fly in from out of town and all around the world, so it's always fun to see. Although I know it is late in some other places right now. And then the last question is just what treatments have you done previously, just so we kind of have a little bit of an idea. So we'll give you guys one more moment. I don't know if I can re-invite the poll if you X'd out of it, but if you want to chat me your answers, you are welcome to. Otherwise, all right, 5 seconds, and then I'll cut this off. Last chance. All right. So, sharing the results here, it looks like a good number of you are existing patients, but a lot of you are not. So I'm really happy. Welcome. Thank you for joining us today. At worst, 50-50 if you have joined one of our webinars before. Most of you heard about this via email. Some of you said other. If you said other, I'd love if you'd chat me and tell you. And it looks like most of you are in San Diego, but we do have people from around the country. And finally, Dr. Groff, it appears most of the people here have not gotten many treatments done. We have about almost half the people have maybe tried lasers, and less than that have tried injectables. So you guys have come to the right place to kind of see what your options are. So with that in mind, I will hand this over to Dr. Groff. As a reminder, this is recorded. You're welcome to put in any questions at any time, and we'll get to them all at the end. And take it away, Dr. Groff.
I appreciate everyone showing up to hear me talk about the Take10 procedure. So a lot of you are probably wondering, I'm sure your interest maybe was piqued by seeing before and after pictures online, or maybe attending another seminar or webinar that we've done. But so the Take10 is a procedure that really has been developed over the last 20 years, as technology advances and our skills advance and techniques advance, we've developed this procedure that we call Take10 because we feel like if you look at the average patient that gets the procedure, it takes about 10 years off the appearance of the face or neck. So the way that we accomplish this is through a customized treatment plan for the individual patient. Now, that being said, a lot of the lasers that we use from patient to patient are the same because these lasers are effective and they do the job that we want them to do, whether it's wrinkle reduction, removal of sun damage, tightening of skin, tightening of the neck. A lot of patients over the age of, say, 40 have the same desires as far as those things. So for a lot of patients, it's a great alternative for a facelift. I mean, a facelift and the Take10 do different things, but they all take time and age off the appearance of our face. Facelifts, of course, is a surgical procedure that's done under general anesthesia and requires cutting and has scarring. You can hide it the best you can, but there's always scars. The Take10 is a laser-based procedure that has no cutting, doesn't require general anesthesia, and can be done in our office and you go home right afterwards. So we do usually do it with light IV sedation, but there are patients that will do just with local numbing. So let's go forward in the presentation here. Now, I want to play this video. This shows some of the lasers that I use in a typical Take10 scenario.
Hey everyone, it's Dr. Groff from San Diego, California, and I'm here with my patient Lola. Lola is 58, and we're going to do my favorite procedure on her today, which is laser resurfacing. We always use a combination of lasers to get the best result. So for her, we're going to use the V-beam Perfecta laser to address broken capillaries. Next, we're going to use what's called a Q-switched Alexandrite laser to ensure the brown spots are gone. And then lastly, we're going to use what's called the Luminous Ultra Pulse Encore CO2 laser, and then we're going to use the Cyton Erbium laser so we can get rid of all the lines and wrinkles, or as much as we can. If you go to look at my before and after pictures, you can go to Facebook and just type in my name, Dr. William Groff, or Instagram, same thing. You're going to see that we can easily take 15 to even 20 years off some of our patients doing this approach. Now, one thing I want to point out is that if you use a fractional laser to resurface a patient, you cannot get nearly the results. And all you have to do is go online and look at the difference in the photos when we use this combination versus someone who just uses a fractional laser. This is laser number 1 for our transformation. We're going to use the V-beam Perfecta to address broken capillaries in the nose, cheek, chin area. And this is the V-beam right here. So we'll get started now. Sometimes I look for best. Another important thing is to make sure that you treat the ear. I always treat a patient's ears because it doesn't make sense to have this beautiful skin here and then have the sun-damaged ears. Many doctors don't treat the ears, which I can't quite figure out why they would skip this important part. Now we're going to go to laser number 2, which is the Q-switched Alexandrite laser. One of my favorites. It's the best laser there is for individual sunspots. So you can see she has a lot of brown spots, and when we do the Alexandrite, you'll see each spot will get a light frost to it. So we'll get some live footage of that. And you can see right here, this is the Q-switched Alexandrite laser, which is the workhorse for sunspots in our practice. We're in our laser suite and we're ready to do the main part of our procedure, which is the laser resurfacing part. So I'm going to be using this laser, which is the Luminous Ultra Pulse Encore, which does the majority of the work. So I'm peeling the epidermis right now, which will enable me to go a little bit deeper and get the best result possible in the lines and wrinkles. You can see the patient's perfectly comfortable. During the 18 years I've been performing laser resurfacing procedures, I've found that the best way to make a patient comfortable is to use a combination of topical anesthesia, nerve blocks using Novocaine, but most importantly, IV sedation, like a twilight sedation, where we use medication via IV to relax a patient, keep them very comfortable. So I just did some work with the CO2 laser. Now I'm going to use the Cyton Erbium. This is my sculpting tool, so I sculpt away the remaining lines. There's already a big difference. Tissue tightening as the laser pulse. So this laser here is the best skin tightening laser or device in the market, period. So you can see that with that instant tightening effect on the upper eyelid. We're almost done. We're going to do a final pass on her lips, because the lips, just like the rest of our skin, gets sun damaged, wrinkled, precancerous spots. So the beauty of this procedure, not only do you get an incredible cosmetic result, but it removes all the precancers from your skin as well. So. So we just finished our full face laser resurfacing. Patient did amazing. You can see during the procedure there was very little discomfort. We do everything we can to make our patients comfortable. She's just washing out her eyes because we did have a protective eye lens in there to help protect the eye from the laser. So we will follow up with her tomorrow, and we'll see how she's doing.
So they did a great job filming that, because it's really difficult when you're using lasers to capture really good video images, and they did a great job. And just seeing like that video again reminds me of what an excellent OR staff we have, because if it wasn't for our OR staff headed by our head nurse, Lindsay, who makes sure our patients are comfortable. You could see in that video that that patient was actually, we were talking, and our OR staff is top notch. We have accredited ORs, and our staff makes everyone feel really, really comfortable and welcome. And that's our number one goal, is to have a great patient experience here. Now, in this photo that you're looking at, you can see it's like a split face comparison, lasered versus not lasered side. So, clearly you can see the tissue tightening, the sun damage reduction, the wrinkle reduction. And the thing I love about this procedure, one of the things, it's one of my favorite procedures to do because it's so impactful. So when I show you the before and afters, and I have a ton of them because it's so reproducible, everyone can benefit from this procedure, from the ages, like I said before, 40 and above, sometimes even in the 30s if they have acne scarring or other things. So this is that same patient, before and 5 months later. And again, just tightening that skin, addressing the lines around the mouth, tightening the upper and lower eyelids makes a huge, huge difference. But it looks natural. It still looks like her. It doesn't look like some morphed, weird, pooled version of herself. I love this. This is a sweet, sweet patient of mine that I treated recently, probably, no, I don't know, 3 or 4 months ago. She's 80 years old, and she just wanted to look like the best version of herself. So when you see the pre-photo, obviously on the left-hand side here, or my left, some things to note, of course, again, are the tissue tightening, the wrinkle reduction. The aging pattern in a female patient is very consistent. You see the lines start to develop, even if you're not a smoker, lines will develop around the mouth, upper lip, we call it the perioral region. And then you start to get the lid laxity, fine lines, crepiness around the eyes. And then it extends out. There's usually less damage in the lateral or the side parts of the face. But in this example, if you look at her lips, you can see that the distance from the nose to the tip after the procedure has been shortened. So something that happens with aging is the distance from the nose to the mouth gets longer and longer. Now you can reduce that surgically, but one of the side perks or benefits of this procedure is oftentimes patients will have that distance shortened because of the tightening effect of the laser. You can also see that she's regained a lot of her natural volume of her upper and lower lip. Now, how does that happen? Well, again, when the laser tightens the skin here, it pulls that lip up and down into the natural position, regaining the youthful volume that they used to have. So that's she had no fillers, no injectables. This is all laser. It's just a side view. She has some sunblock on or something and maybe some moisturizer, but there's absolutely zero makeup on. I know she has sunblock on because I can see the zinc oxide, but she looks amazing. Remember, 80 years old. That crepiness in the forehead is dramatically reduced. All the lines and wrinkles. I just love this patient and her results. Again, she has a little bit of sunblock and moisturizer in the afterwards, or the after photo, but no makeup whatsoever. So we go from 80 years old in the last patient to someone who's much younger in their 40s. So, we all age at different rates, and, we all have different histories of sun exposure and other things that affect aging. So this patient, she was in her late 40s. She had never done anything. So this is an example of a patient where I did a combination of things. So first thing I said is, hey, look, why don't we do some Botox here, the forehead and around the eyes? And interestingly, I also did Botox in her masseter muscle, because from grinding and clenching of the daily tension and stress of living life, a lot of patients grind or clench and they don't even know it. And this muscle gets bigger and it makes the face wider, which makes us look older. So we started with Botox, and I said, hey, why don't we resurface, do a laser resurfacing procedure? So of course I did the Take10 procedure on her, and you can see she looks just amazing, fantastic. Again, we got the 80-year-old, now we had the 40-something-year-old. So it's very consistent. You see the tightening of the upper eyelid. So when I do these treatments, unless a patient tells me not to, I'm going to do the upper eyelid skin from the eyelashes all the way up to the eyebrow. I'm going to go right up to the lash line on the lower lid. I always do the ears because the ears get sun damage too. And I always do the lips, the actual red part of the lips as well. Here's a patient again. Now this one's in her 60s, so in between the 40 and the 80-year-old. So just again to show the tightening and the smoothing effect. She does have a little bit of eye makeup on. We try to get patients to come in with no makeup. We try to keep our photos consistent, same angles, same lighting. Tries our best to get patients not to wear makeup. So she had a little bit of eye makeup on, but you can see again the dramatic change, the tightening effect through the cheek area, wrinkle reduction everywhere. All the brown spots for the most part are gone. Here's one that's again a couple of months after the procedure. She was late 70s, pretty deep lines in this area. She had the broken capillaries, a little bit of rosacea, sunspots. You can see the red spots on the forehead. the thing I love about her photo is look at her upper eyelids. That is not surgery. That is me using the CO2 laser in a fully ablative, not fractional, fully ablative mode, and the erbium laser together to get the tissue tightening that's required to give her that natural. You would think, looking at this picture, that she had surgery, no cutting, no scars, but a very realistic outcome of the procedure that I can do when I do a take 10. Now you will see her lines are much, much, much better on the mouth, but she still has some lines. Sometimes you can't get them all out. If they're super, super deep, you have to know when to say when. You can't go too deep or you get yourself into trouble. And this is where the years of experience doing this procedure come in. So again, if you look at her, we call this an oblique view. You can see all the mottled redness, the large brown spots, the tissue tightening, the upper eyelid tightening. She looks fantastic. This looks like a refreshed, glowing version of herself. Here's a close-up of the eyes so you can actually really appreciate the lid tightening all the way across. And of course, the tightening and smoothing of the lower lids as well. Here's one again. She came in, she just had a thin layer of aquaphor on her skin because she was only 3 weeks out. So 3 weeks out, you're still, even though you're healed over, you're still healing. Your skin's probably going to be a little bit dry. So that's why she looks a little bit shiny. She had a thin layer of aquaphor. But I still loved her pictures because it shows a realistic expectation of what you may look like at 3 weeks. Now, some patients will be a little bit more red than this. Some will be less red. But you can see this picture's obviously unretouched. She still has some pinkness around her mouth, a little bit of pinkness around the eye. But most patients would be like, no big deal, put a little bit of makeup on to cover it until it goes away. The pinkness can last anywhere from, on the short end, I'd say 3 or 4 weeks till it's gone, to worst case scenario I've ever had in my practice where a patient's pinkness can last 6, 7 months until it's completely gone. It's rare, but it can happen. But again, if you look at her picture, you can see the shortening of the distance from the nose to the upper lip without surgery. You can see the wrinkle reduction. Now think about this. Even if you had a facelift, if you were this patient, you know what wouldn't change? These upper lip lines. Because pulling this way, pulling up, whatever you do, is not going to change that dynamic there. So I really like in this picture, and that why I included, I love the wrinkle reduction in the cheek here. So, I mean, I liked everything. I liked everything about the picture, but I really was struck by the amount of textural improvement and wrinkle reduction of her mid-cheek area. Here's another patient, very realistic, 7 months out, looks great. You know, the crepiness under the eyes in her case is what really struck me, the dramatic tightening and smoothing of that under eye area. Again, she doesn't have a stitch of makeup on, no makeup, looks fantastic. There's a close-up of the eye just so you can see that real crepey skin underneath. But you can also appreciate some of the crepiness of the middle part of the upper eyelid here that's much better as well. So very natural look. This patient was in her late 50s, maybe early 60s if I recall. Just a nice refresher, a nice natural refresher. Still looks like her, but looks like her, I don't know, so maybe several years ago, maybe 10 years ago. Very happy, not a stitch of makeup on in that after photo. Again, showing the crepiness under the eyes. We all get it. I mean, even in your 30s, you start to get crepiness. 20s, you start to see crepiness under the eyes. So I do a lot of lower lid, like patients who come in, you don't always have to do the whole face. So I have patients who will come and just want to treat the lower lids or treat the lower and uppers. Some patients will just treat their upper lip. So you don't always have to do the whole face, but oftentimes that's the best call. This patient I treated a few years back. Again, I like to show it because she's 3 weeks out. She has a little bit more olive skin tone. She has darker eyes, darker hair. And you can see at 3 weeks out, she's still a little bit pink. But, I mean, she didn't care because she knew she could go out with makeup on and there's one thing you can't cover with makeup, and that's lines and wrinkles and skin laxity. You know, a little bit of pinkness, yeah, you can deal with that till it goes away. She actually got some really nice, this is one of those cases that she's in her 70s, and you know, her skin's a little bit thinner, but the thinner the skin patients, the skin really tightens up nicely with the Take10 procedure. And you can see that kind of tightening along her jawline there. Same thing around the eyes, the tightening of the upper or lower lids. Dramatic, really impactful wrinkle reduction around the mouth. Again, you can still see the pinkness at 3 weeks out, but trust me, she'll trade that pinkness all day for that wrinkle reduction. This is another patient that I like to show just 1 month out. She's still a little bit pink, but very, very happy because she's got so much tighter, smoother, more youthful looking skin. This patient, obviously, you can see the dramatic difference around the mouth, the lines around the mouth, through the area here on the upper cheeks, the upper eyelids. Again, I have a lot of photos because I've done a lot of these over the last 20 years, and it's very reproducible. And I think if someone tells you, if a doctor or whomever tells you they can do something for you, ask them to see photos, because unfortunately in our industry, there's a lot of nonsense. There's not a lot of nonsensical procedures that don't work. And I'm very honest with my patients. If something's not going to work for them, I'm like, I'll tell them straight out, hey, that's nonsense. It's not a procedure that does anything or does very little, or it's a gamble. You got a 50-50 chance of it doing what you want it to do. Where this, the right patient, and I will tell you if you're the right patient, is a home run. It's the oblique view. And again, looks like her, but looks like her, and I don't know, maybe 15 years ago. Different patient before resurfacing, 6 months after, zero makeup. This one is about 3 weeks out. She might still have a little bit of swelling even from the procedure, but man, what a difference. If you look at her neck, I did some work on her neck as well. This one again, like late 40s, early 50s. I mean, man, what a difference. You look, take your eyes from the left to the right and back and forth. It's amazing how much just that smoother skin makes her look so much more youthful and refreshed. I'm getting rid of the surface sun damage, the mottled skin, the blotchy skin, the brown spots. Of course, the lines around here, you know, getting rid of them makes a huge difference. Now here's another patient with a little bit darker skin that you can see, and she's actually 3 years out from the procedure. Very happy, tightened up all the areas we speak of, with the upper eyelids, the lower lids, around the mouth. The deep lines around the mouth are gone. I'm very happy. A lot of the sun damage, the brown spots, still gone. The rosacea, redness around the nose, still dramatically better. Patient in her 70s, again, just wanted to refresh. Wasn't interested in surgery. Let's take some age off. You don't need to be cut on. You don't need to take the risk of going under general anesthesia. We can help you with just the lasers. The Take10 will customize the treatment for you. This patient I probably treated, I don't know, I like the picture. It's probably like 10 years ago at least, but I like her photo. It's a good story. She wanted, her son was getting married. She wanted to look her best for the wedding. She flew down from Northern California to see me. We did a Take10 procedure on her, which we weren't even calling Take10 back then, but same concept. You can see she looked awesome for the wedding. Again, that textural improvement, the tightening, the smoothing, the lips themselves look better. Great example of the tightening of the upper eyelid, the tightening and smoothing of the lower lid. That puffiness under her eyes, you can see, is dramatically better. The lines here are gone. She's just still a little bit pink, a few weeks out here and here. And there's a close-up of the eyes again, so you can see that tissue tightening on those upper eyelids with no surgery, no cutting. So this is a before and after that I like because she looks so naturally refreshed. Her skin looks beautiful. She's a year out from the procedure. Looks awesome. The thing I love about the CO2 laser underneath the eyes, beyond the tightening and textural aspect, is look how dark and kind of tired her eyes looked. When I use the CO2 laser in fully ablative mode under the lower lids, and you get that beautiful peel, it just refreshes that skin. The darkness improves. You know, when the skin is crepey or textured or wrinkled, it doesn't reflect light properly. So when you have a nice, smooth, tight skin, you get much better light reflectance. And that's one of the reasons her under eye area looks so much better in the after. So this patient, just really her main problem there was that upper lip and then some brown spots and sun damage elsewhere. We can see the difference in the upper lip. This patient I treated within the last year or so. And again, very natural result. Her main issue was the perioral region, but we did her whole face, or I did her whole face, I should say. Again, with the straight on view, you can see the difference in her upper and lower lip area. There's a nice close-up of that. Another nice close-up of this patient. This is before and just doing the eye area. You can see how that alone, gosh, I mean, I think her eyes look 20 years younger. Happens to everyone. The upper eyelids start to get heavy, crepey, start to get lines and crepiness to the lower lids. Here's one I did again within the last few months. Again, demonstrating that darkness under the eyes and how much better it is once we tighten and smooth and give a nice peel, laser peel using the CO2 laser to the under eyes. It's a different patient, some rosacea, a lot of texture going on in those upper eyelids. So I want you to look carefully at those upper eyelids and look at the texture and the quality of that skin. You can see it's like tissue paper, like crepe paper. And then afterwards, look how tight and smooth it looks. Now for her rosacea, I use the V-beam laser, and that's the best. It's considered the gold standard. We have the newest version. It's called V-beam Prima. And there's very few of them. I don't know if there might be one other one in Southern California, maybe in LA. It's considered the gold standard for rosacea and broken capillaries. Same thing. I like this close-up because it shows, if you look in the mirror, you can start to see once you get in your 40s and above, the skin in the middle aspect of the upper eyelid starts to get crepey and heavy and fall. So with the CO2 laser, I can kind of tighten and make that look a little bit smoother. Same concept in this patient, the crepiness of the upper eyelids and the lines on the lower lids. So now we talked about the face. What can we do for a neck? So we have a separate procedure. Well, it's part of a Take10 concept because we can take age off the neck as well through laser resurfacing, but also tissue tightening. So let's watch this video for a sec.
So today we're going to be doing one of my favorite procedures, which is called ThermiTite. ThermiTite is a procedure which is designed to tighten the skin, particularly underneath the chin and in the neck area. Can you extend up? So when patients have a little bit of laxity in this area, this is the best treatment that I've seen in 17 years for this area. So we're going to get started. First, we're going to numb this area, and then I'll show you there's a probe that goes under the skin that actually heats the skin and causes it to contract. You can actually melt fat with it as well. So we're going to get started with the numbing. So you can see we're just going to put a little bit of anesthetic on the right side of the neck here. And then I'm going to have the patient lift their chin up nice and high. And we'll do a little bit here. And then now we're going to swing around to this side and do the same thing. A little bit of anesthetic. Very good. Perfect. So now we're injecting the tumescent anesthetic solution, which will numb up the entire neck area. You can see how quickly we can do this. And there's very little discomfort because I already placed a little bit of lidocaine in the entry point. So we're starting the actual ThermiType procedure. You can see that I have the ThermiType probe is underneath the skin. So the beauty of this procedure is you're able to actually direct the radio frequency energy to the undersurface of the skin where you need it. So you can get that tissue contraction or tightening that you want. You can see we have a camera here that monitors the temperature, so we know exactly what the temperature of the skin is at all times. And we have this infrared monitor which helps us track the heating process. So generally this can take anywhere from 7 to 12 minutes to get the temperature to what we want for tissue contraction. So you can see the patient's completely numb, not having any discomfort at all. And we're just slowly going to deliver this energy to this submental or the area under the chin. Okay, so we just finished doing the ThermiType portion. Now we like to finish that off after we've used the device to kind of melt the fat and cause some tissue contraction. We're going to remove that melted fat with this cannula here. So this is the final part of the procedure for us, and she'll do great. Here we go. So you can see in the tube there, you can see some of the fat that's coming out. So this is just our way of making this procedure the best it can possibly be. You have the tissue contraction from the radio frequency device, but then we actually remove the fat too, so it's a win-win all around and they get the best result possible. She'll drive herself home from this procedure, which is amazing. There's no reason patients can't be awake and alert for this procedure. They have no pain because we numb them completely, so they can drive themselves home, which is great.
So you can see this is a patient that I did some laser on. I did some BB and fertilization. And if you look in this area underneath her neck, underneath her chin, that's from one treatment with the ThermiType procedure with microlipo, which we developed here in our office. Let's just go through these quickly. This patient, I did a little bit of chin augmentation using a filler, 1 syringe of filler, but I also did the ThermiType procedure on her neck. And you can see the combination. She has a little bit better chin projection. She looks nice. So I'll just click a couple examples really quickly so we can get to some questions and answers. This is a procedure that this neck procedure is a standalone procedure. It only takes about 45 minutes average. And patients drive themselves home because they're completely numb during the procedure. It's one of the few probably truly painless things that we do here, just because they're so well numbed with this procedure that you don't feel anything. It's kind of like when you go to the dentist and you have cavities, drilled, there's work going on, but you don't feel any pain. Well, at least if you have a good dentist. So here's a good one. A lot of fullness under that neck, and you can see that nice reduction in fullness. She actually has somewhat a nice jawline now. So oftentimes patients will combine this procedure, the neck procedure, with the Take10 for the face. Now you can see there's usually very little downtime when we do just the neck with the ThermiType procedure. This is 3 days after. You can see a little bit of bruising, but she already looks way better. It's pretty amazing. And the same patient 3 days later, looking already a lot tighter. And she will continue to experience continual tightening for at least 6 months after the procedure. Here's a patient 1 month after. This one's, I think, 3 months out, if I recall. This guy's 6 weeks out, and he'll continue to improve. So it's a great procedure for men and women, and so is the Take10. Here's a gentleman I did. I mean, just amazing. Look at you know, area under his chin there, and that's 7 months after. He looks so good. I was so happy for him. So again, no surgery, no cutting, no scars. Younger girl, 39. So, you know, we have a lot of patients coming out with genetic predisposition for this fullness here. So I have patients in their even 20s that I've done this on. So all ages, anywhere from the 20s to 80s, I've done this procedure on. Here's a young nurse. She was like 33. She's had a little bit of fullness there she didn't like right underneath the chin, and boom, 1 week later looks much better. And 2 months after that looks even better. So again, I'm going through these quickly. These are all on my Instagram or on our website. So you can see all these pictures. All these videos are on YouTube. You just type in Dr. William Groff on YouTube and you watch. I think there must be 100 videos of me doing different procedures on there. So this one's great because she got a nice, her jawline back in addition to reducing the fullness under her chin there. So just like I said, I have countless examples because this procedure, like the resurfacing procedure, is very reproducible. This patient, I resurfaced her face and I did thermotite on her neck. So you can see the textural improvement of the face and then the tightening of the neck and the sun damage reduction as well. This one, again, I resurfaced the face. You can see the tightening from the thermotite procedure with the neck. So a nice combination procedure. We've seen this patient earlier. One last thing I just wanted to quickly mention. A lot of patients don't realize it's treatable. If you have blue veins under the eyes or under the temples, usually with one treatment, I can get them to go away. We use the V-Beam Prima for that treatment. It's a great treatment. It's very quick. The results are long lasting. They rarely ever come back. Once they're gone, they're gone. So just something to keep in mind, because again, I see a lot of patients who have no idea it's even a treatable thing. So I like to mention it at the end of my presentation. So perfect. Now we can take some questions.
Perfect timing. Thank you
Right.
so much. That was
Yeah.
amazing. And these
Thank
people
you.
on the screen, of course, are Dr. Groff's beautiful family.
I got to update that picture.
Yes, I know your daughters are a little older now.
Just a little bit, yeah.
All right, so let me make him a little bit bigger so you guys can see the one and only. All right, let's get through as many questions as we can. So this one actually was even before you started, but it's a great question. Is there a limit to how much laser you can do on the skin? Does it thin your skin over time?
Yeah, no, that's a great question. I get that question a lot. It's actually a misnomer. It actually thickens the skin. So every time you have a laser procedure, because of the new collagen and elastic tissue production, your skin actually gets thicker. So they've actually done clinical studies on that where they biopsy the skin before and after laser treatment, and the skin's always thicker and healthier after.
So to take 10, is this always a fully ablative CO2 or is it ever a fractional CO2s?
Usually, if a patient has acne scarring, then I prefer a lot of times the fractional mode. But for patients that have wrinkling and want the best tightening, then it's fully ablative. And really, the difference in downtime between a fractional CO2 laser and a fully ablative is just a matter of like 2 to 3 days. So it's worth the extra couple of days in the long run, for sure. Because you'll never see fractional results like you see with fully ablative. It's impossible.
So let's get into the recovery time. So
Sure.
what kind of pain can someone, expect, and can they be in the sun right after? How long do they stay out of the sun for?
So, everyone's experience is different, but it's extremely rare that I have to prescribe any pain medication for procedure after this. Patients sometimes take Tylenol, Motrin, but no narcotics. It's very rare. Oftentimes patients will drive themselves to see me the next day or two. Now you're going to look beat up. You're not going to look, this isn't a procedure. You can't get 10 years back without sacrificing something. So you're going to sacrifice your time, meaning 8 to 10 days of recovery. And you're going to have to realize you're going to look swollen and red and brown, and you're going to peel. So that's how there's still, to this day, 2023, there's no laser that can work magic and get rid of lines and wrinkles without downtime. This doesn't exist. If someone tells you it does, they're just trying to sell you nonsense, So,
But you're right.
but yeah,
We see these patients all the time. And I mean, it's a couple weeks in the big scheme of things, which is nothing. And of course, there's no cutting or incisions at all. So it's
right.
just like this kind of
And-
sunburn.
Yeah, and we live in Southern California. So of course we have patients fly in from all over the US to do it, but the majority, probably 80% of our patients live here in Southern California. So we have horseback riders, we have surfers, golfers, you name it. So sure, during the recovery period, you're not going to be going out in the sun, but after that, you're smart. You wear sunblock, you wear a hat. You don't have to, but you want to protect your investment, of course.
Yeah. So how about, but I mean, can people go back to work? What if they're working remotely and, on the phone? Can they do those things, or
You
how
can
long?
definitely work if you're working at home. Of course, you can definitely work. I mean, you're probably going to work the next day, but maybe give yourself a couple of days. But absolutely, I have patients who do work the next day. You're definitely not going to want to go into the office, though. You're not going to want other people to see you for at least a week, I would think. Now, I have had patients, believe it or not, who've flown in and have flown out the next day. Would I ever do that? No, but people do it.
I mean,
I don't
we've seen
recommend that.
crazier
I
things
don't
here.
recommend that, but it's
Okay.
happening. Yeah.
So can you do both the face and the neck in the same session?
Oh yeah. Well, I just did patients the other day. We did face, neck, chest, and arms.
Oh, wow.
Different lasers. On the arms we use different lasers, but for example, if a patient has a lot of brown spots and sun damage, we'll do the combination, usually the Fraxel and the Alexandrite laser. So no, you can do lots of areas in one day, which is nice. One period of downtime.
Definitely.
Yeah.
So this person said the after photos look amazing. Do you recommend touch-ups within 6 months to a year? And did most of the patients that you showed us, how many treatments did they have?
Oh, every single one of the patients in that presentation have one and only one treatment. That's the whole point. You do one treatment and you look great for several years. Now, to get the best longevity out of your procedure, particularly for the upper face, it's always a good idea to do Botox. I mean, probably, we do it between the brow, the forehead, around the eyes. That's the best way. And then, of course, a good skincare regimen. So, we discussed all these things with the patients, pre and post-op.
Mm-hmm. So what are any of the side effects that you could get from a CO2 laser, and specifically for anyone with darker skin?
Well, it depends, well, first let's start with the common side effects. So you got your initial downtime. After that, there is going to be some pinkness or redness to the skin, and it's usually a little bit, just like I showed in the pictures, it's going to be more intense around the eyes because the skin's very sensitive and thin, and then around the mouth, because that's usually where I have to do the most aggressive work to get rid of the deeper lines and wrinkles. So you have to understand that there is going to be a period of time you might have to use makeup to cover up the pinkness until it goes away, and it always goes away. Sometimes it's 3 weeks, sometimes it's 3 months until it's completely gone. That there's a small risk of temporary hyperpigmentation. There's a very, very small risk of infection, but we put all patients on antibiotics beforehand to prevent that. So those are the most common.
So how about someone that has darker skin? Can you do this for them?
Well, I would say up to a point. So I would say a light, there's a Fitzpatrick scale of the skin. So Fitzpatrick 1 would be the darkest. I'm sorry, Fitzpatrick 1 would be the lightest. Fitzpatrick 6 would be the darkest skin. Okay. So I would say maybe Fitzpatrick 1 through 3 would be okay. Above that, there'd be too many risks involved with long-term hyperpigmentation and things. But patients that have darker skin don't usually get deep lines and wrinkles. They age differently. Their skin ages differently. They get more of the brown spots, which we can treat.
So are there treatments that you can do for people with those darker skin types?
Well, yeah, that's why we fortunately have, our 60-some lasers. So we have lasers to treat anyone from the fairest skin to the darkest skin. So definitely.
Yes, absolutely. So
Yeah, for sure.
no matter what your skin type is, we have a laser for you.
That's
All
right.
right. So this is a really just a nice comment from Catherine. She said, I had this Take10 procedure a few years ago with Dr. Groff, and I'm thrilled with my results. I love Dr. Groff. He is the best.
Oh, that's very nice. Thank you. Appreciate that.
So are there any of the lasers that you use in the Take10 that are for those blue temple veins?
Well, that's the beauty of the whole Take10 concept and the Take10 procedure. When you come in for a consultation, I have you hold a mirror and we look at all the things. And if you have the blue veins and they bother you, well, then we include that in the Take10 package. If you don't, we don't need it. If you have brown spots, we use a certain laser for that. But if you don't have brown spots, then we don't need that laser. So we really customize it to whatever the patient needs and or wants.
Understood. Okay, here's
Yeah.
a great question. What about men that want to keep their facial hair? Does it remove their hair?
Oh, no, that's a great question. So again, that's why we have 60 lasers. The lasers that we use for the Take10 do not affect hair growth whatsoever. So it will not affect beard growth or whatever. So we have specific lasers for laser hair removal, and the ones we use for Take10 are perfectly safe for men.
Got it.
Yeah.
So someone's asking just to clarify maybe the names of a couple of the lasers that you most likely will choose for this Take10.
That's top secret.
Uh-huh.
No, it's all over. If you go to any of my posts on Instagram or Facebook, whatever, I always include the full name. So the most common lasers, the big heavy lifting lasers are the Luminous Ultra Pulse Encore CO2 laser, the Cyton Erbium laser. Those are the ones that I use to tighten the skin and get the wrinkle reduction. Commonly for the, like I mentioned, the talk for the broken capillaries, rosacea, I use the V-Beam Prima, and that one for the blue veins as well. And then lastly, one of the most common ones for brown spots is the Q-switched Alexandrite laser.
And I just want to clarify with that even though other people might have these tools, it's not just the tool. There's a lot of settings and technique that goes into this. So
oh, there's so many different settings. These lasers have so many different, there's the strength of the pulse, there's the length of the pulse, there's the cooling mechanism, there's so many different settings. It's kind of like you could get, if Risa, if I give you like a racing car to drive, would you drive it as well as a guy who's been racing cars around on a track for the last 20 years? Of course not. You probably crash and burn, right? So these lasers, they can be very dangerous. It's not, you can't take a weekend course and be good at lasers. It's just like anything else in life. Experience matters. And that's why here we're all board certified dermatologists who have a passion and a love for this. And we've been doing it for many, many years. And that's why we think you're in the best hands when you come here.
So let's see, how for out of town patient, how are follow-up appointments handled? Are they done virtually or do you go to a different doctor?
Yeah. So again, we tailor to whatever the patient's needs are. I'll have patients that'll come in, do it maybe like literally. I just had a gentleman from Palm Springs today that I did a Take10 on yesterday. So he came in the office this morning. He's out of here. He's already on his way back to Palm Springs. He's going to mail me, not email me. He's going to text me his photos on Monday. So in this day and age, we can do a lot of the follow-ups via email or texting.
All right, love it. So we have a lot of different questions about ages in here. What's the youngest that someone might consider this? And if they're younger than that, are there other options? And is there a top age limit of when you're comfortable doing this?
Well, I've done just like I showed in the presentation, that one woman was 80, but I think the oldest maybe like 86 that I've done in my career, and youngest, usually in younger patients, it's more an issue for acne scarring where I'll use a combination of lasers to help them with acne scarring. So I'm surely patients in their 20s. So, but it's all customized. This isn't like a cookbook recipe that you follow. It is customized for what I see when I examine you and then what your desired outcome is.
Yes, thank you for clarifying that.
Yeah, for sure.
So how long do the results last if you do a good job with sunscreen?
Right. I would say in the short end, like 4 to 5 years, on the long end, 9 to 10 years.
So if you have this once in your, 50s, could you do it again when you're 60 or 70?
Oh, 100%. I've done that many, many times because, like you mentioned, I've been doing this for about 20 years, a little bit more. So I think I've done it 3 times or maybe a couple of patients, but a lot of patients I've done it certainly twice.
Cool.
Yeah.
So, all right, a few more minutes for some more questions. So a couple
Okay.
people saw that you were treating really close to the eyes. Someone said they have
Very close.
some spots on each of their upper eyelids. Is that something that you can treat? And how are you able to treat the eyes safely?
I love treating around the eyes because it's a thing that probably 99% of the doctors out there are not comfortable with. So I love doing things that others aren't comfortable with. So we place a protective, it's called a corneal shield, but it's basically a protective contact lens. We put a couple numbing drops in your eye, then we put this protective contact lens in, and knock on wood, I've never had a single eye injury in my entire career. So because we know how to protect the eye. Yeah, knock on wood.
Knock on wood,
We're
right?
good. Yeah.
But yeah, you couldn't see in there, but there were these metal shields on the inside
Yeah.
of the eye.
Yeah. So, it's that, and it's just being cautious and having the patient adequately comfortable. And it's just so no problems.
All right. So before we get to a couple last questions, of course, the big question everyone wants to know is, what does something like this cost? And I know
Right.
that's hard because it's fully customized, but what are you comfortable saying?
Well, I mean, it's anywhere from, we have our medical assistants do all the pricing, and it's all on the computer, but it's going to be at least a few thousand to several thousand. Or, if a patient's doing face, neck, chest, then it can be more than that. So it just depends. Like if a patient's just doing their upper lip, it's going to be a lot cheaper than doing the entire face. So
Yeah. And so during a consultation, someone could come in and get pricing on maybe just this area or the whole area.
right, yeah, we always like to, because we never assume that someone wants to come in and spend a fortune, right? So we try to give options. So if it's just primarily the mouth that bothers the patient, we can do just around the mouth. We don't have to do the whole face, right? But we'll give you the option of doing the full face versus just around the mouth. So that sort of thing. So, but I will say now, to get these 10 years back, if you compare it to the price of a surgical facelift, which I would say on the low end in San Diego, if you're going to go to someone who has a decent amount of skill, it's going to be starting in the 20-some to 30-something thousand. And then we have doctors in San Diego now charging close to $100,000 for a surgical facelift. So they do different things, but again, to get those 10 years back, there's no comparison.
Absolutely not. And a lot of people are asking, like, how does this compare to RF microneedling or BBL? And you've kind of addressed that.
This is my biggest point. If someone tells you that microneedling can get you a significant, impactful result, please ask them to see 10 or 20 photos of patients that they've done it on that show an impactful result. Because I can tell you, we have microneedling with RF in our office, and I rarely touch it. It's got to be the right patient with the right need. And so there's a lot of overselling, overhyping, of course, in this industry.
Absolutely.
The same with product. Yeah, go ahead. Sorry.
2 more questions and then we'll let everyone go on with your evening. So this is a good question. This person had a treatment with you about 10 years ago, and they said they agreed their downtime was about 2 weeks.
Okay.
They're wondering if they get it again, has the procedure changed? Is it any, less abrasive than it used to be?
I find that when patients do the procedure again, they recover more quickly. But the technology's changed. We do have a newer CO2 laser, so the technology is better. Of course, with time, skills, techniques get better, right? So yes, things have certainly changed. Our V-beam laser is newer. It's more powerful than it was 10 years ago. So there are definitely technological advances, and so yes.
All right. Well, that leads perfectly into this last question. Some people are saying, are there any newer, better lasers that we know are coming that we should wait for? Or is there any reason to wait?
No, because, us being a major research center, in fact, I think we have probably one of the largest research facilities in the US anyway. Unfortunately, there's nothing coming that I see. And I don't see anything coming significant for at least a few to several years. Unfortunately, I wish.
Yeah, exactly.
Uh-huh.
We would see them a couple of years ahead of time because we would be
Right.
doing studies. I
Yeah,
agree.
and we'd be excited about it.
But we have phenomenal technology in the office, so you guys don't have to
Oh, we
wait.
have the best. We have the cutting edge. We have the newest of everything, the best of everything. So we're very fortunate.
Yeah. And so people are saying, when you're saying when do the results end, they don't really go away. You don't all of a sudden get, 20 years added to
No.
your face.
In fact, after the procedure, I'd say patient's skin continues to improve as you're building. So from being lasered with the CO2 laser, we know that you'll build new collagen elastic tissue for at least a year, probably a year and a half. So there's initial wow factor and then continual improvement. And then this slow aging starts to happen again. But there are things you can do to slow that, like good topicals, and of course, Botox and things like that can help too.
All right. Okay. So we have more questions, but you guys, I really suggest you follow Dr. Groff on social media and CL Derm on social media, where you
Sure.
can, learn more. And of course, coming in for a consultation, because having Dr. Groff examine your face, he will be really honest and tell you what's reasonable, what's realistic,
Yeah.
and help kind of create a treatment plan for
And
you.
we still do virtual consults too for patients who are, live all over the US, right? So you can at
Yes.
least start with that.
Great point. Great
Yeah.
point. And I love what you said, for you guys all to remember that if anyone else is telling you about procedures or something else fancy, I would ask to see anyone that can show you as many photos as Dr. Groff just did.
Or just even a few, because again, there's so many overhyped procedures, med spas selling this and that. Well, say, hey, do you have 10 pictures of patients you've personally treated with this laser? And 9 times out of 10, they're like, no.
Yeah.
Unfortunately.
Absolutely. All right. Well, this was amazing. Thank you all so much for spending an hour of your time with us. We really hope this was educational and you learned a lot. And we would love
Sure.
to see you if you're interested. And if not, we hope this was very helpful and you'll at least follow us on social media. We do have a drawing. So one lucky winner here is going to get $500 towards a Take 10 with Dr. Groff. So I will do a little, I have a little software right now to pick a winner, and we will notify you tomorrow, so that just for HIPAA, so we don't say anyone's name here. So I will get that done right now for those of you that stayed till the end. And otherwise, a lot of people are saying thank you. Thank you so much, Dr. Groff. This was
Sure.
amazing.
My pleasure. All right. Well, thank you. Thank you for hosting, Risa. We appreciate your time.
Of course. So thank you all so much. And we hope to
Yeah.
see you at CL Derm soon.
Yeah. Thanks for tuning
Bye.
in. Yeah. Bye-bye.